Hello everyone. Today I am going to take class on common renal disorders. First one, renal hypertension. In renal hypertension, the wall of arteries supplying the kidney begin to thick in order to withstand the pressure, and that result in a narrow lumen. A narrow lumen means less blood and oxygen get delivered in the kidney, resulting in ischemic injury to the glomeruli. Nephritis. Nephritis is an inflammatory disorder of kidney. The commonest and most serious ones are pyelonephritis and glomerulonephritis. Pyelonephritis. Pyelonephritis is also known as pyelitis. It is the acute inflammation of pelvic region of the kidney due to bacterial infection. Initially, it may be accompanied by high fever, chill, severe back pain, pyuria, high BP, etc. It is common among young children, particularly young girls and also pregnant women. Glomerulonephritis. Glomerulonephritis is also known as Bright disease. It is the severe inflammation of glomeruli. The glomeruli become swollen and the glomerular membrane become highly permeable to the most of the blood constituent. This results in albuminuria and hematuria. Albuminuria is a condition in which the urine contains proteins such as albumin, whereas in hematuria, the urine contains blood cells. In rare instances, the glomerulonephritis affect only limited number of glomeruli, then it is called focal or segmented glomerulonephritis. The three histological varieties of glomerulonephritis are minimal change glomerulonephritis, proliferative glomerulonephritis, membranous glomerulonephritis. The commonest symptoms include swelling of face, eyelids, reduce in urinary output, presence of albumin and blood in urine, rise in blood pressure, etc. Renal calculi. Kidney stones are the solid and insoluble concretions of crystallized salt and other constituent of urine. The common constituent of the stone include calcium carbonate, calcium oxalate, calcium phosphate, urates and uric acid. There are different kinds of stones. They are silent stones, staghorn calculi and dendritic stones. Silent stones are the stones which are formed in the pelvic region of the kidney, causes no pain and produces no other symptoms. The others causes pain and hematuria and pyuria. The stones may grow large and get highly branched. Such branching kidney stones are called staghorn calculi. They may fill the entire pelvis and almost the calyces. The stone occupies only a few calyces. Such stones are called dendritic stones. Factors responsible for kidney stones. They are excessive intake of mineral salt, low water content in the body, hyperactivity of the parathyroid gland, infection of the kidney, lack of vitamin A in diet, high level of calcium in urine. Edema. Edema is the localized swelling of body parts. It results from excessive accumulation of the interstitial fluid in the tissue space beneath the skin. The major causes of edema includes blockage or obstruction to blood flow through vein, obstruction through the flow of lymph in lymph canals, excessive lymph protection, rise in capillary blood pressure, which forces out blood plasma to interstitial fluid, increased vascular permeability to protein, inadequate renal retention of sodium and water, local inflammation in which capillaries become more permeable, cirrhosis, tumors and other diseases of liver, acute typhoid fever and pneumonia, starvation and poverty which cause extreme protein deficiency in the body. Acidosis. Acidosis is an abnormal clinical condition in which the body pH is below 7.35. It is either due to the production and accumulation of two abnormal acids, namely acetoacetic acid and beta-hydroxybutyric acid, or due to the loss of bases. In severe acidosis, the total body sodium and total body potassium becomes low, plasma sodium levels fall slow, and the level of plasma potassium remain almost normal. The common symptoms of acidosis include general lassitude, severe vomiting, increased thirst, restlessness, presence of acetone in urine. There are two types of acidosis, namely respiratory acidosis and metabolic acidosis. Respiratory acidosis. Respiratory acidosis is characterized by abnormally high partial pressure of carbon dioxide due to the hyperventilation of lungs and hypercapnia. Hypercapnia is a condition in which our bloodstream contains high level of carbon dioxide. The major causes of acute respiratory acidosis are the use of narcotics, sedatives, barbiturates, cardiac arrest, pulmonary edema, severe pneumonia, bronchospasm, tetanus. The major causes of chronic respiratory acidosis are pulmonary disease, brain tumor, stroke, arthritis, prolonged pneumonia, and obesity. Metabolic acidosis. Metabolic acidosis is characterized by the abnormal accumulation of non-carbonic acid in the extracellular fluid or by the excessive loss of bicarbonate from the extracellular fluid. The major cause of metabolic acidosis are gastrointestinal and renal loss of bicarbonate, renal dysfunction, adrenal dysfunction. Alkalosis. Alkalosis is an opposite condition of acidosis. Its pH is above 7.45. It is due to the low hydrogen ion concentration in the arterial bloodstream. The major symptoms include tremors, feeling faint, muscle spasm, nausea, vomiting. Dialysis. It is a procedure to remove waste product and excess fluid from the blood when the kidneys stop working properly. Dialysis performed in acute kidney failure or to remove drug or poison from the body. There are two types of dialysis. They are hemodialysis and peritoneal dialysis. Hemodialysis. This is accomplished by using a machine and a dialyzer. Blood is pumped out of the body to the machine where it is passed through a series of tiny tubules in an artificial kidney. It is used to treat acute and chronic kidney failure. Peritoneal dialysis. In this type of dialysis, which uses peritoneum in a person's abdomen as the membrane through which fluid and dissolved substances are exchanged with the blood. That's all about the topic. Thank you.